So I would like to kick us off and get us started. So as I said earlier, this is the second event in our Family Week, so welcome. And this event is focusing on advocacy. We had the title on before a number of people joined, but this is the title of the event. So it's bringing about change for children and families. And we're focusing on how Families' National Advocacy Program is influencing care reform. We will be looking at a number of two actually different projects that are ongoing in the National Advocacy Program. But just before I get started, I'd like to note, most of you are aware, I'm sure, that today is the 20th of November, which is the 30th anniversary of the Convention on the Rights of the Child. So happy anniversary to everyone. It's a very important day today. We are celebrating 30 years of the CRC, and it's very fitting within the context of the discussions today, because I'm sure, as you will have seen from the videos that were shared before this event, most of the projects that we are working on are targeting achievements that are ultimately hoping to see the CRC a reality. So it's a very important day for us, and you will see as the three panelists from the two separate projects will discuss, we are striving to ensure that children grow up in safe, caring family environments. So I'll start off by just giving you a very, very brief overview of who Family for Every Child is, for those of you who do not know. But do not hesitate to go to our website, www.familyforeverychild.org, to get more information on Family for Every Child, our members, and the work that we're doing. Essentially, we're a diverse global alliance, and currently we have 36 members of hands-on national organizations, or local CSOs, as most people call them. We work with millions of children in extended family care, also children in institutions, children in detention, children on the street, and those who do not have adequate care even in their own families. And in very brief, our goals are to prevent family separation, strengthening families, and ensuring high quality alternative care is available when needed for children and families. So that is, in a very brief nutshell, who Family for Every Child is. And the program under Family for Every Child that brings us here today is a national advocacy program. And I will very quickly run through who we are as a national advocacy program and what our aims are. And one of the many ways in which Family for Every Child seeks to achieve change for children is through influencing national, regional, and global policy. And we target decision makers and power holders at all these levels. NAP also provides, through the Secretariat, technical and financial support, as well as accompaniment before the strategies are implemented, during the creation of the strategies, and all the way through the project implementation to our member organizations. So these are members who are interested in developing or further strengthening advocacy strategies, or if they want to create networks nationally and regionally, as well as those members who want to forge strategic partnerships that will support them in influencing care reforms in either in their national, regional, or global context. And just to very quickly run through the current advocacy initiatives that are ongoing, we have 7 different projects with a number of members collaborating and working together. And the first is in Paraguay, who are targeting lawmakers in an advocacy initiative that is ensuring that the first ever law on alternative care includes working with families and children and adolescents who are separated from their family environment. The second is Ghana and Liberia. Our members there are collaborating in an advocacy initiative to promote positive discipline. And this is a means of enhancing children's care, both in schools and in home, as well as preventing family separation. The third is in 4 countries in Cambodia, Philippines, India, and Nepal. And these members are advocating to raise awareness and seeking change to care facilities, changing the attitudes, and also enhancing the quality of support for boys who are survivors of sexual violence. Then we have Mexico, USA, and Guatemala who are working on advocacy in the region, Central and Latin American region specifically, to make migration safer for children. The fifth is Turkey, Egypt, Indonesia, and Kyrgyzstan. And these members are all working together on advocacy that is supporting better care options, particularly foster care, or for example, foster care. And this is more suited to the Islamic context. In the 6th project, which is one of the projects we're looking at today, we have Guyana and Jamaica. And this is a joint advocacy project on creating national and regional advocacy networks on supporting the rights of families with children with disabilities. And this is also going to extend to the Caribbean region. And then last but not least, we've got Zimbabwe, who have also had technical input from our members in South Africa and Rwanda. And this is an advocacy project that is enhancing the recognition and resourcing of kinship care as a well-assessed, supported, and documented practice in Zimbabwe. So in a very quick nutshell, this is what we have currently as the advocacy initiatives that are ongoing. And we are more than happy to give you more details about that as we proceed. I'd like to now introduce you to our panelists who will be answering questions today. I'm sure by now you have seen the videos that were shared a week or so ago. And the panelists today will be answering any further questions that you have on the presentations that were given. And I'll start by introducing myself. My name is Francina Mundwa. I am one of the senior program advisors in the Secretariat in Family for Every Child, and I am based in South Africa. Then we've got Omati Madre, and I will read just a very brief bio of our panelists so that I get the information correct. And Omati is a managing director in ChildLink in Guyana. And ChildLink's vision is a Guyanese society where every child has the right to grow up in a safe and secure family and community protected from abuse, exploitation, and violence. Omati's work in ChildLink has been focused on working collaboratively with civil society, local authorities, and government agencies to strengthen the national child protection system. Omati has a background in social work, business management, and displacement, as well as conflict and human security. Then we've also got Sandria Longwhite on the panel. So Sandria and Omati are working on the same project in the Caribbean. Sandria Longwhite is the projects manager at Community-Based Rehabilitation in Jamaica. And CBRJ is a CSO that is providing community-based interventions and therapeutic services to children with disabilities, as well as their families. Over the past 30 years, Sandria has worked with rural services for children with disabilities, and then worked with Community-Based Rehabilitation Jamaica, serving in various capacities. Sandria holds a BSc in nursing from Northern Caribbean University in Jamaica. And then last but not least, we have Blessing Mutama, who is the National Program Manager for Farm Orphan Support Trust, that is FOST, in Zimbabwe. Blessing works with FOST and FOST supports and protects vulnerable children in Zimbabwe's farm worker community specifically. And FOST's long-term goal is to achieve sustainable, care for orphaned children by encouraging responses that emanate from the community themselves. Blessing is a seasoned development practitioner with over 16 years experience in NGO project design, planning, implementation, and monitoring and evaluation, focusing on children and youth development. So those are our panelists for today. And as we proceed, we will begin with a few questions from myself. And when I open up to the floor for all of you to ask your questions, please do remember that on your right side of the screen, there is the request to speak button. So you click on that in order for you to speak and ask your question to the panelists. And as soon as you have asked your question, please click on release mic so that you are no longer on the screen. And I would also like to remind our panelists that you need to continuously have your mic on mute and then switch it on when you are speaking. So just also in reflection, because today is the CRC anniversary, it's a very important day, as I've mentioned. And what is very interesting to note is how there is still a challenge 30 years later in implementing the CRC, and many governments still deprioritize a lot of the rights that relate to children and families. And as you will have seen from the presentations that were given by our panelists, a lot of the work that they're doing is to ensure families stay together, that children grow up in a family-based environment. And the CRC is not always implemented in many countries. And one of the main problems is resources. You will hear in advocacy discussions, the challenge is always there aren't sufficient resources. So one of the key messages that our members are highlighting to governments and practitioners and to the community is the push to ensure that the CRC is adequately resourced. And by that, I mean, whatever acts nationally and at a local level that are implementing the CRC should have a budget attached to them. And that is one of the biggest challenges that we face, especially in countries that have smaller budgets and countries where states might not have that will to actually do something about it. So today, as we discuss, this is one of the things that we will take a look at. What are governments actually doing to ensure that families are kept together? But that is meant to be translated in terms of resources. How can the CRC become a reality? And our members are doing that in terms of their advocacy work. So I'll start with a question to you, Omati. One of the things that I noted in your presentation was the work that you're doing with children and families with disability is focusing on either government policy or the work that is supporting children, schools, parents, and families. So it could be pushing for policy on the other hand. Do you think that it should be one or either or all of the above? What would the best approach be in order to support children and families with disability?
Thanks, Fran. Hello, everyone, and thank you for joining us. And again, a good celebration on the 30th anniversary. I think it's quite an interesting question when you are designing these interventions to really understand the kind of longer-term outcomes that you want to see that is taking place for children with disability. For us, and I mean CBRG and also ChildLink, what we thought about in assessing where we are at this point in time, both countries with specific reference on how children with disabilities are treated and are receiving services, we recognized that we do need to work with the children themselves. We need to hear from children where possible, what are their concerns. We need to listen and to understand. We need to work with families particularly the carer, the parent that has responsibility for that child. So we understand what services are provided, what are the challenges, what are the gaps, and really to design an intervention that will support long-term outcomes, that will create a change that can be institutionalized by the agencies, by the government agencies, that will take that responsibility over time and institutionalize it, and that these changes are not in the short term. And so it's really important for us in designing this initiative that we work directly in the schools, which we are doing. We work with the children and with their parents. We are also working with our ministries of education, both in Jamaica and in Guyana. We are also working with the schools. The schools are an important stakeholder because we would like to support the school in becoming a place of change, a place where children can, particularly children with disability, where children can go and find their place in society and make their contribution, and where they can be able to learn at their level. And imagine listening to the presentation, you would have heard both Sandra and I making some reference to the individual education plan. So this plan actually allows the child, the parent, the school to have an integral role on how we will support the child to learn, to be safe, to be able to grow, to be able to make their contribution. So the intervention really requires for us to work at all the different levels, and more so to work with government for long-term policy changes, making sure that education officers and teachers have the skills. And if it's not there, for us to include in the intervention training for the teachers in Guyana. For the first time, our teachers have learned how to develop the individual education plan for children with disability. That was not something that they were doing. Whereas in Jamaica, that is something I believe most children already have in place. And it's a plan that helps the teacher to work with the parent to support the child. And so really the intervention needs to happen at all the various levels, and really to ensure that the children's voices and the children's situations, their concerns are coming out in the intervention, that we are understanding it and that we are recognizing how to take this forward with the parents, and importantly with the education department for the long-term change.
Sorry, I had my mic on mute. Thank you, Omachi. That makes a lot of sense. I'll hand over to Sandria. My question for you, Sandria, is at the end of your presentation, you in your call to action, you talked about self-advocates, which is really interesting. How in your work do you involve children and families with children with disabilities? How do you involve them in your advocacy work in Jamaica?
Fran, could you move to blessing? Sandra is struggling to hear.
So, I think I heard somebody speaking, yeah?
Could you move on to blessing's question, please?
Sandra is struggling to hear. Okay. Blessing, my question for you is, in terms of your work with the government of Zimbabwe, particularly, if I understand correctly, the Ministry of Social Welfare, how have you managed to get them engaged and involved in your advocacy work?
All right, thank you very much, Fran, and thank you everyone for joining. Yeah, as you know, that most governments, they are bureaucratic. So at times, pushing for something, influencing something to happen, might take time. A single paper might take a month or even more, in one office for it to move from one person to another. So we have had challenges here and there that can be seen, when you are carrying out advocacy. But I can say We have done well so far with our government. We are working well. And I think the important thing is to first get the buy-in from the government, because they are the custodians of the children, and we are there to complement, their efforts. So we are looking at the gaps where they are not able to, to support the children. We then identify those gaps, but we have to work together so that we identify those gaps, and then be able to assist the children. So what we have done as an organization, what was critical was for us, first of all, to be clear on the message or the change that we actually wanted to influence. Then after we were able to, to identify the message and the change, we then had to, in most cases, the governments, they want the evidence. Because when you are claiming, that something is not right or something is working well, they need the evidence. So we were able, with support from Family for Every Child, to do 2 pieces of research. And these pieces of research have actually helped to back, our facts as an organization. And this helped us to get support from the government. Then also, we then had to identify the target, because we are working with the Ministry of Social Welfare, but we had to target certain individuals. Is it the permanent secretary who has more influence? Is it the director of the department who has more influence? So that you then engage them, have meetings with them, engage them, explain to them what you're trying to achieve. Then I think lastly, we also engaged strategic partnerships, where we identified some of the partners, some of the organizations in the civil society that are in Zimbabwe that have got influence. It's either maybe they've got a better working relationship with a certain government department that we wanted to engage, and then we would work with them, to approach that department so that would influence the change that we wanted to achieve. Yeah.
Thank you, Blessing. Excuse me. Yes, it is indeed a challenge to get the government involved, but it looks like you're doing quite well on that front. Sandra, can you hear us now? Technology is always a problem.
Yes, I can hear you now.
Great. My question for you had been relating to self-advocates that you referred to in your call to action in your presentation. And I was wondering, how have you managed to get children and families involved, especially children with disabilities, involved in your advocacy work? How have you managed to do that in Jamaica?
Well, we recognize that children with disabilities have a right to live a full and decent life with dignity and, as far as possible, independence, and to play an active part in the community. And children themselves are very important, and even parents, because a lot of the children that we work with don't have a voice that way. So their parents act as their voice. They play a vital role. In fact, the agency started out of the demand of parents for better services for their children. And when we started in the early 1980s, we had what we call community-based rehabilitation workers. But then we realized, as we trained the parents, it became apparent that first, parents themselves needed more education and training, yes, and being a parent of a child with disability was an asset to the work that we were doing. So we realized that the parents themselves needed to be more involved in what we were doing as it relates to the program involvement, rolling out the program, implementing the program, but not only that, but also bringing about change in the community at that level and the society and government level as it relates to new policies. So we started to train the parents themselves, and we facilitated advocacy through conferences, creating advocacy and lobby conferences, holding workshops, training, meetings with opinion leaders and policymakers. And we, in fact, in the late 1990s, established a national parent advocacy movement that had representation right throughout the island. And we also, not only in Jamaica, but that was something that we shared with other countries in the region also, that initiated parent advocacy groups. So since then, we have been really using parents as advocates and have brought about changes to services, improved services, and increased partnership with some of the government agencies that we work with.
Thank you, Sandra. That's very interesting, and really, it is a difficult task. I think just as it is hard to get government involved, it is hard to get parents and communities involved in
Yes, it is.
advocacy. So that sounds great. So I'd like to now invite questions from the floor. And so in that regard, I'd like to remind you that if you want to ask a question, please look at the bottom right side of your screen. There's a blue tab there that says request to speak. Please click on that so that we can hear you and you can ask your question. You can also opt to ask your question through the chat box. Which is on the right side of the screen. Please click request to speak. And once you have finished asking your question, please do release your mic. So please click on release mic once that is done. Just checking if there are any questions that are coming in through from the messages. Maybe I could ask, because I can't see any requests right now, I could ask you again, Omati. I think Blessing referred to the challenges that are related to advocacy involving government. Overall, in terms of advocacy and engaging people who have the power to change certain things, what challenges have you faced? How have you seen those challenges, and what are the solutions that you've employed? Sorry, before you answer that question, I see Joy is on to ask a question. Maybe I could get that question from Joy. Joy, could you unmute your mic in order to ask your question? Joy has disappeared. Back to you on that question. Are there any overall challenges that you've faced in advocacy, particularly in engaging government or communities, and how have you overcome those challenges?
Thanks, Fran. Working with children with disability, a critical aspect of it is really early detection and really early screening and recognizing what is the disability and what sort of support the child and the family will need. And that is a big challenge for us because we, as a society, have not necessarily done any significant work or developed any specialized or significant services for children with a disability that any child with a disability can easily access. And therefore, not having that sort of information or not having that sort of background to approach government makes it even more challenging. Working with government to create change at the national and policy level will always remain a sort of a fragile collaboration, a fragile partnership, because government always wants to look good and not necessarily be shamed, and really wants to have the credit also, but don't necessarily always want to do the work that comes for that kind of changes. And ideally, what we have been doing with our ministries is really to find champions in the ministry. Education officers who want to see this change happen, education officers who are willing to go the extra mile to create that kind of change and building that sort of camaraderie with departmental heads, with education officers at the regional and at the community level. Building those sorts of relationship, unfortunately, does have more disadvantages than advantages, in that once there's a change, then you have to rebuild that whole process. But for the time that the person is there, you are able to have much more easier access to the school, much more easier access to training teachers, and building a parent-teacher relationship that works in the best interest of the child, but also allows the school to have more understanding and the community to have more understanding and awareness on the issue of disability and how to work with children, how to protect children, how to not stigmatize and discriminate children, but make sure that children with a disability that is coming to school, that they're not placed at the back of the class, but that they're given a chance within the classroom. And that's at the level of the school and at the community. At the national level, we work collaboratively with local partners. You would have noticed in the presentation the autism walk and the month of activities that we would have referenced in the presentation. Our local partners, step by step, they organize with the First Lady of our country, who she's the patron to that organization, and they organize the National Autism Walk. And we support it and bring other local partners as well to be a part of that walk. So it creates more of a national level awareness when the First Lady comes to an event and speak on that event. And that helps us when we go to the education ministry or any other ministry to be engaged, that we are going with added support, so that we are given a better chance of being listened to, and therefore local collaboration and not engaging the ministry on your own, and collaboration that engages key persons in government, champions within the agency and outside of the agency, in this instance, the First Lady, to come on board and really to have a face and have a voice on these issues.
Thank you, Amati. That's really a comprehensive approach and multi-layered in terms of different ways to get people involved. I like the champions aspect. That's a really great idea. I see that we've got Joy back. Joy,
Okay.
are you able to ask your question?
Yes. This goes to Sandria. Can I go ahead?
Yes, please do, Joy. We can hear you.
Yes, Sandra, when you are running through what you're doing, I think it's very interesting. But I'm just wondering, do you encounter any challenges, especially if you have already a policy framework for those who are with disabilities, and how do you go about the challenges if you still if you don't have a policy framework in place? Because it sounds like your government is very accommodative. So I'm wondering, what is the motivation on your advocacy?
Okay. Yes, that's a good question. Yes, our government is very accommodating, and we do have a disability policy. We have a Special Education Act, which is before Parliament now. But we do have an active advocacy group, Combined Disability Association, which are the adults really with disability who have been pushing. And we have a strong disability sector. So our networking within the disability sector with agencies who work with children and adults with disabilities, and also the self-advocates themselves. We meet fairly regularly, and they have a mandate as it relates to ensuring that policies are in place. So we have been working over the years towards that. The government themselves have recognized the need for, or the Jamaican government has recognized the need for of the rights of persons with disabilities themselves. We have what we call Jamaica's Council for Persons with Disabilities, who also, as it relates to advocacy, works on that area, plus also providing some social services through that arm for persons with disabilities. The Ministry of Labour and Social Security, who is ultimately responsible for disability in Jamaica, also have several programs for persons with disability. And there is a special education department in the Ministry of Education, which over especially the last 5 years have been working very hard to ensure that our children with disabilities are not left behind and are included in the education system. So they have, for example, increased their partnership with us as a CSO working on the ground to ensure that the gaps between the services that they're providing and the needs that are there are being filled. We still have a long way to go, but I mean, when we look at what was happening 15 years ago, where we have progress and the partnerships that have been created through advocacy, self-advocates, and also advocacy from parents and organizations, we really have made strides, especially in the last 10 to 15 years.
Thank you, Sandria. So it looks like a lot of action from the citizens, which is, I think, a really good lesson. We always talk about advocacy that needs to involve citizens, and it looks like that's quite strong in Jamaica. What I would want to even ask you, linked to that, is there a difference between, or do you understand why there's a difference between some governments who are very receptive in the Caribbean region and some who lag behind? What do you think is behind that, where some are really strong and others are not?
I think what Amati said earlier in terms of the involvement, engage in the community, engage in government. When we're having forums, there's always a government representative there. When we're having workshops, we try and include the community, as many stakeholders as possible, to keep disability in their minds at the forefront. And whenever there are policies being developed, to actually have a voice in it, be a part of the stakeholders meeting, have representations there. You always have to keep disability in the view of those who are and the policymakers in the community at that level, to be able to get some traction. And also the role, we can't underplay the role of self-advocates and the parents themselves in pushing for these issues locally at the government level, that the changes are there, the services are provided.
Thank you. Thank you for that.
If I can add to that, Fran.
Yes, sure. Please go ahead.
We also found what we found in our work together is that in Jamaica, they have stronger civil society advocates on the issue of disability, not just for children, but also for people with a disability. And this has been since the late 70s and developed really well in the 80s and really progressed. We've had actually the champion that came through those decades of just recently no longer with us, but we've had strong civil society intervention in Jamaica. In Guyana, civil society organization growing into lobbying and supporting government has been more of a recent sort of a growth in, I would say, in the past 10 to 15 years. And so this is really one of the key contributing factor, but also what we found is that the education ministry in Jamaica had been more child-friendly compared to some of the others in thinking more comprehensive on the concerns and the services that all children will need.
Hello, looks like we lost Omati.
I'm still here. Are you hearing me?
Oh, you're there. Oh, okay. Sorry, there had been a break there.
Okay. Did you hear me for the first part?
Yes, I heard
okay,
you.
Great.
We're struggling. Blessing is struggling to get on, back on. So he's popping on and off. So please keep trying, Blessing, if you can hear us. He seems to be struggling. I think, Georgina, you mentioned that there was a question from yourself, or is it Andres who had a question?
Yeah, sure, Fran, thank you. I was wondering, this is either for Sandria or Amati, how broad your regional advocacy network goes. So how many organisations and countries are involved, and how regularly do you plan to meet as a network?
Thanks, Georgina. At the moment, we are developing our national network in both Jamaica and in Guyana. We do aim over the next 3 years to work specifically in the more populated regions of the Caribbean, which would be in addition to the two countries, Trinidad and Barbados. We are also, as we are engaging other Caribbean meetings, are assessing some of the other Caribbean society that are likely to be engaged. So the focus now would be Guyana, Jamaica, Trinidad, Barbados.
Hi, Omati, I think you might have cut off at the end, but I did hear the answer, and we've got Blessing back. So Blessing, while we have you, we could ask you a question. Sorry, you're going through so much trouble with connection. What I wanted to ask you was, I know you have been also working as FOST to try and ensure that kinship care is included in policy. And I know there's a policy that is being revised in the coming months in Zimbabwe. Could you tell us a bit more about that and how you're hoping to influence that change? Because it is quite a task.
Yeah, so for us, we engaged the government together with civil society. So we had about a 3 days training where we were looking at kinship care, the importance of kinship care in Zimbabwe. And like I said earlier on, that we had actually started a scoping study on kinship care in Zimbabwe, which really helped to back, our facts, which were saying that kinship care is not being really recognized, and supported well in Zimbabwe. So, during that training with the government and the civil society, we then realized that one of the biggest policy that we have on children, the Zimbabwe Orphaned Care Policy, which was established in 1999, and since then it has never been reviewed. So from that meeting, we agreed that we are going to start to review the policy. And one of the things that we are trying to push for is for kinship care, to be recognized, within that policy. Because, the policies spoke a lot about foster care and institutionalization, and just a few lines were in the policy which spoke to issues around supporting children in kinship care. And the government, they're actually on board with us, and they've agreed that yes, kinship care is the prevalent mode of care in Zimbabwe, which really needs to be supported. And one other thing that we are also pushing for is for the government to allocate a budget. When they do the government budgets and they allocate budgets, like to the Ministry of Social Welfare, we want them to allocate a specific budget that will be looking at support for children who are in kinship care. And this is one of the ideas that the government has also, accepted, and they are on board with that idea.
Thank you, Blessing. And that sounds like it would really be a great achievement. I've just seen another question coming from Lopa. A very interesting question. I think it's related more to government influencing. So Lopa is asking, do you see both your country governments able to influence each other? And if yes, what would some of the ways be? So your country governments, do you see any potential for them to influence each other, or have they done so already? That's to Omati and Sandria.
Yes, of course. There's absolutely opportunities for this sort of influence to be at different levels. We've had, actually, Sandria came to visit, and it's out of that visit we were able to bring together civil society organizations that are working in disability, and really to design or to develop the first draft of the special education needs policy, and to present that to our government. We were able to do that based on the policy that Sandria have in place, to look at what they have in place and to then do the consultation and present a draft to our government. What we've also done is to introduce the consultant that came from Jamaica to do the training in Guyana to the education officers. We've also introduced Sandria as a representative of CBRJ to our education officers. So we begin to build that relationship that of key personnel that will share with our government officers on the progress of Jamaica. But I'll let Sandria share a little bit on some of how the influence can also happen in Jamaica, because we do plan to continue lobbying for the special education needs policy and to use the progress that Jamaica has made.
As it relates to the involvement of government, the joint project that we're presently involved with, the Ministry of Education played a key role in, part of it is in including children with mild autism into schools. And from the beginning, we had dialogue with the Ministry of Education, the Special Education Department, and they're the ones who really identified the children, introduced us to the school, endorsed the project that we're doing. So they are actively involved in what we are doing from the go. And they know of the joint initiative with Guyana. And in fact, when I spoke to the Chief Education Officer in the Special Education Department, she had already gone to Guyana to meet with the Education Department there to talk about the special education policy. So already that link is there. So we see the opportunity for greater collaboration between our ministries and to push the work forward that we want.
Thank you, Omati and Sandria. And that's really interesting because as much as we want to collaborate as organizations, we have to bring on board our government institutions as well. And the big challenge is ensuring that they buy into it to the level that we would like to. And that's part of the advocacy, that's part of the influencing. It's a lot of hard work. I'm sure you have seen already that it takes time. And in my discussions as well with Blessing, he did express, that there are quite a lot of challenges, especially in terms of the understanding of kinship care and getting the issue itself on board and being understood. If there are no further questions, I'm just getting a message that there are no further questions, and we're about to wrap up. It's already 1 hour that's passed, so time flies. I'd just like to wrap up by once again emphasizing that with the CRC being celebrated today and with the discussions that we've heard already so far from our members, and do feel free to follow up with us and the communications team and family to find out more information about the advocacy work being done. It looks like there is really a lot in terms of advocacy that could be done. However, it's a slow, and some would even call it painful process when you are advocating for change, especially in difficult issues such as disability, where there's always a stigma attached to children and families with disability. They're a hidden group. And the same applies to children and families in kinship care. They seem to be less visible than the average families that you will find in child protection systems. And that's where the hard work is, ensuring that that change happens. And what we've heard today from the panelists is that you are employing quite a lot of strategies on different layers, both government, schools, communities, leaving no one behind, essentially, to ensure that all of it comes together and that some change does ultimately happen. The idea of identifying champions, as identified by Guyana, is a really brilliant idea. Ensure that you do get those allies, people who are willing to support your work, and ensure that they push forward the agenda. And in Zimbabwe, I witnessed it when I was working with FOST, that there are some people within the government departments of social welfare who are very keen to push these issues forward. So when we look at the CRC and when we talk about, 30 years, the reality is it's about resources, it's about money, and pushing for governments to ensure that they put their money where their mouth is, because the CRC is very widely ratified, very popular as a convention. However, the implementation is quite a challenge. So just to round up, I'd like to thank the panelists for your fantastic presentations, and to encourage you to keep on working. The good work is still to be done. A lot of challenges ahead, but a lot of success is already being paved the way for in terms of advocacy. And in concluding as well, I would like to encourage you all to take the poll that is going to be released in a few minutes, or in the next minute, has been released now. Please click on the right side of your screen and click on polls and just take the poll. Very few questions, very quick, and do feel free to sign up for our mailing list on our Family for Every Child website. So that's www.familyforeverychild.org, and do sign up for our mailing list. If there are any further questions, please do feel free to approach us at Family for Every Child, and we would be happy to discuss the projects further. So thank you very much, and do feel free to take the poll. We'll still be on for a few minutes, so take your time in taking the poll. Thank you very much.